Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Sodium-containing acetaminophen associated with CVD in individuals with and without hypertension. Many previous studies have found high sodium intake to be associated with increased risks of cardiovascular disease and all-cause mortality among individuals with hypertension. The findings on the effect of intake among individuals without hypertension has been ambiguous. A recent study in the European Heart Journal has reported that sodium-containing acetaminophen was associated with a statistically significant higher risk of incidence of cardiovascular disease and all-cause mortality than the non-sodium-containing acetaminophen initiation among individuals with and without hypertension. European League Against Rheumatism recommendations for cardiovascular risk management in rheumatic and musculoskeletal diseases. Patients with inflammatory rheumatic diseases have an increased risk of cardiovascular disease in comparison to the general population. Now, this largely tends to affect the quality of life, which has prompted the development in 2010 and its update in 2015-16 of the European League Against Rheumatism, that is, the EULAR recommendations for cardiovascular risk management in patients as published in the Annals of the Rheumatic Diseases, which has brought out 4 principles emphasizing the need of regular screening and management of modifiable for cardiovascular risk factors. A total of 19 recommendations were developed covering 3 topics, that is cardiovascular risk CVR prediction tools, interventions on traditional cardiovascular risk factors, and interventions on disease-related cardiovascular risk factors. The use of generic cardiovascular risk prediction tools is recommended due to lack of validated rheumatic diseases specific tools. These recommendations can guide clinical practice and future research for improving cardiovascular risk management in rheumatic and musculoskeletal diseases. PIT study shows exercise can help older adults retain their memories. According to a study published in the journal Communications Medicine, exercise that gets the heart pumping has shown promise in increasing the brain health, and experiments have shown that it improves the memory. The researchers have found that there were greater improvements in memory among those who were at age 55 to 68 years compared to those who are 69 to 85 years old. The study also found that greatest effects of exercise in those who hadn't yet experienced any cognitive decline and in studies where participants exercised consistently several times a week. So exercise is the new goal. Herbs that protect the heart. Bilobalide reduces cardiac damage in myocardial ischemia. Energy in the form of adenosine triphosphate, popularly the ATP, is produced by breaking down the carbon resources like glucose, lipids, or even the amino acids. Myocardial ischemia is a condition in which the blood flow to the heart is drastically reduced, preventing the heart muscles or the cardiomyocytes from receiving enough oxygen. The study, which was published in the Journal of Pharmaceutical Analysis, reveals how carbon transfer from the glycolysis pathway to the tricarboxylic acid cycle is blocked in myocardial ischemia cases, thereby affecting the cardiomyocytes. The authors discovered that the tricarboxylic acid flux was clearly disturbed in these cells, which preferred to use alternate carbon sources rather than glucose to provide a constant supply of energy. Omicron variant less likely to cause another subvariant BA.2 infection. Recent variant Omicron has rapidly spread worldwide, carrying numerous mutations in key regions that is said to have increased the transmissibility and immune escape. People infected with the highly contagious Omicron variant of COVID are less likely to get BA.2 infection. Though Omicron is on the decline, many countries in Europe and Asia have seen an increase in the BA.2 cases. The reinfection rate appears to be low given the high number of positive SARS-CoV-2 tests during the study period, and the study also highlights the need for continuous assessment of duration of vaccine-induced and the natural immunity in its patients. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.